Good afternoon. Today is unprecedented in the history of Texas PTA. Not only are many of us gathered here at the state capitol, but across Texas, from El Paso to Port Arthur and communities in between, our council PTAs are holding watch parties where they bring families and volunteers together. In fact, if you are watching online, you will, watching online, please let us know that you are online and where you're from, and just type it in the comments underneath the video. And thank you so much for joining us. I do wish that we were gathered here under better circumstances. I wish we were coming together to celebrate someone or something. But instead, we are here today in order to confront a danger sneaking into our schools and making our kids sick. E-cigarettes have been around for a while, but with popular fun flavors and marketing aimed at kids, students as young as middle school are getting hooked on vaping. This trend is only on the rise. The number of teenagers vaping has doubled in just the last 2 years. What can we do? How can we stop something hiding in plain sight in our classrooms? Joining us today is a panel of guests who know all too well the dangers of vaping. They are parents and students, physicians and advocates. They come to us from the front lines of this issue. They from Texas schools and from the most revered institutions in the state. I would also like to introduce some special guests seated in the audience. Kathy Martinez-Prather, Executive Director of the Texas School Safety Center. Jeff Williford and Katie von Rosenberg, representing the office of Senator John Cornyn. And several agency representatives are present today. Thank you all for being with us. Before we begin, I would like to extend my gratitude to the American Heart Association for collaborating on today's event with Texas PTA. The American Heart Association has been vocal about the dangers of vaping and how the ugly truth hides behind these toxic clouds. Please welcome Tanya Edwards, Executive Vice President for American Heart Association.
Thank you, Sherry, and thank you to all of you that are here representing the front lines of this epidemic. You know, the American Heart Association is working hard to provide evidence-based solutions to our communities to help fight the epidemic. We're working hard to protect our children, your children, and the administrators that are working in our schools. I think most of you know this and have probably heard, but for those of you that may not be as aware, there have been decades of progress of reduced smoking rates. But in the last 2 years alone, the incidence of teen vaping has more than doubled. Today, there are more than 5 million students that are vaping, using e-cigarettes, Juuls, puff pods, and they've been targeted by tobacco companies. They've been marketed to, and many of these children do not believe these products are harmful. In fact, almost 70% of kids, when they start vaping, think they are only inhaling flavored air, but we know that that's not true. One pod, one Juul pod, one puff bar, represents the exact same amount of nicotine as a pack of cigarettes. And in that is a highly addictive chemical, nicotine. And when these children begin vaping, they are now susceptible to being addicted to nicotine, which we now know impacts cognitive development. So for these reasons, this is an epidemic, and we must combat that. So everyone here today is representing our schools, where this is a frontline issue. But it's not only an issue for our schools or parents, it's a community issue. We must band together if we're going to change the stats, if we're going to change this epidemic. So I'd like to say thank you for everyone that's here. Thank you to the Texas PTA, thank you to the local PTAs that are watching, and thank you to the concerned community citizens that are here. With all of our help, we really believe that we can change this in the state of Texas. Thank you.
Thank you, Tanya. And again, thank you to the American Heart Association for all of the great work that you are doing. Before we begin, we have a few housekeeping items. To our seated audience, please refrain from talking with your neighbors. We want to respect our guest speakers and listen attentively. We will be opening up questions to the audience later in the event, so please hold on to your questions. To our online audience, thank you for joining us today. We will be addressing online questions as well. Please submit your questions to our panelists in the comments section below the live feed. Make sure you include your PTA name, the school district that you're from, and to which panelist you are directing your question. Thank you, and let's get started. Our first panel today represents school communities and the youth perspective. From left to right, please welcome Kellen Crook. Kellen is a team ambassador for the statewide tobacco prevention program, Say What. Kellen is a 2019 recipient of the Regional Youth Advocate of the Year Award from the Campaign for Tobacco-Free Kids, and he was a leader in the Texas 21 Youth Coalition, testifying in the House and the Senate in favor of raising the age to buy tobacco in Texas. Anna Carey is a student in Fort Worth. Through her own personal battle, she now volunteers to speak to other students about the dangers of vaping. Anna works to educate parents on the warning signs of e-cigarettes use and how to help young people quit. Samantha Boy serves on the advisory board for Parents Against Vaping E-Cigarettes. She testified in favor of Senate Bill 21 to raise the age in Texas, and she is the ambassador of the Catch My Breath Vaping Prevention Campaign. Tricia Vasquez is a board member of Monterey High School PTA in Lubbock. She recently developed and delivered a new program called Teen Vaping, Reaching Generation Z, sponsored by Monterey PTA. And please welcome Dr. Jeannie Stone, Superintendent of Richardson Independent School District. Dr. Stone has been recognized for her leadership and community impact by the Texas Educational Support Staff Association, Altrusa International. And just last year, Dr. Stone received the Texas PTA Superintendent of the World. I'll go for that. But she received the Texas PTA Superintendent of the Year Award, and having been nominated by her entire community in Richardson. So now we will hear from each of our panelists as they share their stories. Kellen, would you start us off?
Hi, I'm Kellen Crook. I'm 19 years old and currently classified as a sophomore at Texas State University. Eat 'em up, cats. My story is unique. I began my advocacy because of one simple fact, that tobacco use is the #1 most preventable cause of death in the United States, and I started in 2015, and that's still a fact today. I am a people person. I've always been that way. That's how I grew up. I like seeing people do good to themselves and others. So when I saw this fact, I knew I needed to make a change. So in 2017, I became a Say What teen ambassador, and from there, I began educating my classmates more and more about the dangers of tobacco. After completing my first term as a teen ambassador in 2018, I knew I needed to do even more. I became a national youth ambassador for the Campaign for Tobacco-Free Kids and learned more about the Tobacco 21 movement. Then, in the beginning of 2019, I became a leader of the Texas 21 Youth Coalition here in Texas. That coalition worked towards seeing Tobacco 21 get passed into law here in Texas. Then, at the end of the legislative session, I got to see Tobacco 21 become a law here in Texas. And then in 2019, I also received the Regional Youth Advocate of the Year Award with the Campaign for Tobacco-Free Kids. The biggest reason I am in tobacco prevention is to see my friends and family not die from this terrible epidemic. Last year alone, I witnessed Juul and other e-cigarettes essentially take over middle school and high school. I attended a small 3A school in Lufkin, Texas, and saw, of my graduating class of 55, at least 50% of them become addicted to vaping. And I've heard stories of kids hiding their vapes in their jacket sleeves, taking a hit, and then blowing out the smoke in their backpack like they were pulling out their computer. In college, this hasn't changed either. Walking in the quad, going to class, I see a lot of students just blowing their vape clouds out in the middle of the quad. And then some have even gone as far as turning off their fire alarms in the dorm so that they don't set off the fire alarm. Vaping has grown alongside my tobacco prevention career. When I first started, nobody knew that we'd be sitting here talking about a device that was supposedly supposed to be a cessation device. When I testified to the House and Senate here in Texas, I said high schoolers are graduating with not only a high school diploma, but also a degree in addiction to nicotine. This is still a problem today, and I plan on continuing to help stop youth addiction to nicotine.
I'm Anna Carey. I'm 17 years old, and I'm attending school in Fort Worth. I started vaping when I was 14 years old. I was a freshman in high school. I started it because why not? I was just at a friend's house. There was no like real reason behind it. I just kind of did it. And like what was one time gonna do? Then from there I became addicted to vaping. I went from the Vive Views to the Juul to the Enjoy, and I would go between every class period. It was like a joke between me and my teachers that I would go to the bathroom so much. I actually lost a couple of my middle school friends because of it, but I didn't really care. I continued to vape. I would constantly get in trouble by my parents. They put out news articles constantly for me to read. I saw people getting sick. They made me write articles about vaping and why it's bad, but I didn't listen. I don't think punishment works. I think that schools can punish a kid however much they want, but they have to remember that addiction is a gene, and if you're not addicted, then you're gonna stop. But if you are addicted, you need solutions to help you to stop. If there's AA, if there's NA, then why isn't there things for teens that are addicted to vaping to help them stop? So, early in November, I was hospitalized for vaping. I was in the hospital for 5 days. The illness came on quick. It wasn't like slow. I didn't have trouble breathing. I didn't have many sharp pains in my chest. It just happened one day in the span of an hour, and I couldn't breathe. I had the worst pain I've ever felt in my entire life, and I was stripped from all of my energy. The worst part about being in the hospital is the unknown. So how are you going to know how to treat an illness if you don't know what you're putting into your body? That was the worst part, and them saying that I hope you're going to be okay, not this is how we're going to fix this. In conclusion, I want y'all to remember that I was in National Honor Society, I was active in sports, I was overall a good kid, but so no one would suspect me to be vaping, but I was, so don't count your kid out. Thank you.
Hi, my name is Samantha Boy, and I testified in favor of Senate Bill 21 about a year ago. I definitely agree with everything you're saying. I have a daughter who's here in the audience who was severely addicted to the Juul product a few years ago. My daughter's been in recovery and she's been in 6 rehabs. I attribute her Juul addiction to her severe addiction. Like you said, you're a great kid, honor roll. All these kids don't know how dangerous these products are. We have a severe youth vaping crisis. I believe it's the most serious public health crisis we have faced in years. The issue is children do think it's just a water vapor, but it is an aerosol. They don't realize the amount of nicotine that's been patented in it, and it does create an immediate addiction, and it does create a buzz and a high right away. The flavors mask the nicotine, so these kids don't taste any nicotine. They take a puff, they're hooked. I'm here just to represent my daughter. She's been sober for 16 months now, and just educate parents, teachers, everyone about this epidemic. Thank you.
Good afternoon. Just days before school started last August, I was putting together a poster for our PTA table at Back to School Night at Monterey High School. It was literally a cut and paste job. I was going old school. I needed poster board, scissors, and glue. And in looking for a glue stick, I couldn't find one in desks and drawers, so I reached into my daughter's backpack, and what I pulled out was a vape. I want to tell you a little bit about my daughter. Just like Anna, she was a member, or is a member, of the National Honor Society. She ranks 6th in her class of 575 at Monterey High School. She has a grade point average of 4.76. She excels in choir, having been to area auditions 2 years in a row. She has been praised by teachers and school counselors for being hardworking, kind-hearted, and helpful. She's not the type of kid you would expect to vape. When my daughter and I talked about the vape I found and where it came from, I learned it was purchased at school from a friend for about $60, nearly 9 months before I discovered it. My child was curious, and what she found was, when she first vaped, was that the nicotine kick eased her anxiety. That's another thing about my daughter. She's a high achiever. She carries a lot of stress. Although she knew vaping wasn't a good choice, the feeling was comforting. My first reaction was, I am so close with my kids. How did I not know? The truth is, a lot of parents are as naive as I was. I just wasn't aware and didn't educate myself because I didn't know what I didn't know. I did not know that 28% of high school students vape, a statistic my 3 teens, as Kellen said as well, they believe is far too low for what they see on a daily basis at school. I did not know that vapes came in the shape of eyeliner, highlighters, flash drives, and AirPod cases. I did not know that kids were vaping in class using simple gestures to hide their actions. My hope today is that we can share our knowledge and stories, equipping us with information necessary to in turn educate school staff, parents, and students on the prevalence of vaping among our teens. Thank you.
Good morning. I'm Dr. Jeannie Stone, and I'm the superintendent of Richardson ISD. That's a suburb sort of north of Dallas. We have about 39,000 students. And today I'm here to talk to you about, really, I was trying to think about what could my comments be. I could share with you about the rise in occurrences that we've had at our high schools and our junior highs. See, we identified vaping as a serious problem last year, and we started tracking the high numbers of incidents in our junior highs and high schools. In an attempt to be proactive when we started this school year, we formed an anti-vaping committee in August made up of parents and students and staff members to raise awareness among students and families and parents. Really, we found that there was a lack of awareness with our parents in our community. Well, I then put out a letter to all of our parents because we still continue to see rising numbers. And I detailed the harmful effects to a child's health, citing information from the American Heart Association and from the American Lung Association and other leading organizations. I talked about our new Texas law that a student can be charged with a felony if they are vaping and it contains THC. This letter included photos and research and all kinds of things to raise awareness for our parents of all of the things that have been described here about how these things can be hidden. We even hosted a parent community meeting in our community and had very little attendance. It was put on by some of our students who care about their fellow classmates, and they wanted to raise awareness in our community. Yet still, today is the 118th day of school, and we've had 167 occurrences of vaping in our school district, and 26 of them have been vapes that have contained THC, which is a felony arrest. Life-changing consequences for our students. But what I really want to tell you is about a story that happened as recently as last week. A quick story of 3 students in a restroom who were sharing a vape. They'd gotten it easy access to it, and they were attracted to it because it tasted like apple and told their principal that it tasted really good. They were second graders. And the way we found out about it was because a 6th grader walked into the restroom and found these young kids that were sharing it around. They had had it in class. It looked like a USB drive. No one had even known what it was. We've had 4 elementary occurrences that have happened since this school year began. And as an educator, it's my job to protect students. And I wondered after that occurrence, if those second graders had lit up a cigarette and there had been a match or a lighter, would we have been as shocked about that? I've thought about that. And what I want to do is partner with the PTA and everyone on this panel to raise awareness. We have to get fired up about this. I am here on this panel because I care about kids. I bet if I were to ask every single one of you in this audience, do you have a kid that you care about? Everyone would raise your hand. Everyone watching at your schools and you know, all of the live watches that are going on, every single one of you would raise your hand. We all have to raise our hand as advocates to this cause. It's been described today as a crisis, an epidemic. We have to get that out of our schools. So I want us to shift our focus, and I want us to remove the apathy that exists, that's out there in society, and realize that if something isn't done about this now, then this focus is going to shift down into our elementary schools. It's going to creep down into 6th grade, 5th grade. It's already in our elementary schools. And we have to do something about it before this is just the norm. And it's going to take all of us working together to treat it like the crisis that it is in our country.
Thank you, Dr. Stone. A little while back, Texas PTA started to collect questions from the community for today's panelists. We saw many of the same themes run throughout the questions. I'd like to begin with a couple of questions for our students. Anna, for schools to truly impact a student's decision to vape, what direct yet compassionate steps can they make?
I think that, like I said earlier, punishment isn't really an option. They're not going to quit if they're addicted. But something you need to keep in mind, which was mentioned earlier, was that kids use it as a self-medication. So they see their parents taking medicine for their anxiety, and they have their glass of wine at night. And so they're like, well, why can't I use something to help me with mine? And also to remember that some kids use it because they're depressed. They see kids getting hurt, and so they're like, oh, this can be a silent killer for myself. I can use this more. I know so many people that saw people getting hurt and saying, oh, good, I can vape more now. So.
Thank you. Kellen, when speaking to younger audiences, what are some of the greatest myths students believe about vaping, and why do you think these myths prevail the facts?
Well, most students just think it's vapor, like water vapor, any sort of vapor that doesn't contain any chemicals that could cause cancer. It's a common knowledge that it does have nicotine in it, but they just decide to just kind of put that to the side because it gives them a buzz. It gives them a push to keep going. The myths that the reason why the myths prevail over the facts is just because, like Anna said, why not? A lot of students have the same idea of just why not use it? Everybody else is using it, so why not me?
Thank you. And I have a question for the moms. Samantha, since vaping does not occur in just at schools, what proactive steps can parents take at home?
You've got to go through everything in your kid's room. Every crack and crevice, backpack, bathroom. These devices now come, the new thing now is disposable flavored. Mm-hmm. So now they're even smaller, they're disposable. They even come in toothpicks now. Lipstick, highlighters, you name it, you won't be able to figure out what it is. Also, nicotine test your kids. They're on Amazon, they're cheap. I would absolutely do that. If your child is late to school, having excessive tardies, absent, moody, irritable, coughing up blood, you smell like a candle smell in their room all the time, just look for warning signs from your kids. And I would like to follow up with something you said earlier about how being fired up. I've been fired up about this for 3 years. People thought I was crazy. I called this an epidemic 3 years ago. No one listened to me. I think a lot of the problem is with parents. Parents are okay if their kids vape, as long as they make good grades, they're still playing sports, oh, they just vape. I talk to parents who are like, well, my kid doesn't drink, she vapes. My kid makes good grades, she vapes. I even spoke with a pulmonary nurse at my gym who allowed her daughter to buy Juul pods under her Amazon accounts. Another thing you need to watch for, these kids have fake IDs, they're buying them online, check the mail, don't let any packages come through the house without checking it. You have to be on top of everything because they're so easily accessible to children and they're so easily hidden. No one knows what's going on, and it starts with the parents.
Thank you. Tricia, how do you envision PTAs in schools working together to end vaping, and what works and what needs improvement?
I envision in our high school working together, hopefully with our Lubbock ISD, to implement a curriculum. Currently, we don't have one in our school, and I think that's tragic in my opinion. I really believe that just in my research, small groups is what gets kids talking and what is effective with kids. I wholeheartedly agree with Anna that punishment is not working. And so we need to get them in an environment where they can have discussions with their peers that will encourage and help them. Me sitting up in front of a bunch of kids is not going to change their minds.
Right.
And so I really encourage, I hope Lubbock ISD as well as school districts across the state to implement the curriculum, but also to implement it in a way that really is effective in helping our students say, hey, this is not a good idea.
Thank you. Dr. Stone, we are aware that school districts are struggling to know the best way to address this health crisis. What have you found to be the best approach for both the safe and efficient running of the school and the health concerns of the students, vapors?
Could you repeat that again? I didn't hear the last part.
The last part is, what have you found to be the best approach both for the safe and efficient running of a school and the health concerns of student vapors?
So in terms of the efficiency of running a school, so much of that has to do with building safe relationships and ensuring that all students have adults that they can go to. I think, I've heard about what the students have said about that consequences are not working, and we find that to be the case too. What had been really interesting to me, I was able to visit with an associate professor of the University of Texas Health Sciences Department, and it was the first time that I really shifted my focus to empathy for the students. As an administrator in the school, we're so often thinking that consequences are the answer. And there have to be campaigns out there working with our parents, but the schools really have to shift with education. A lot of that, the voice has to come from students. We find that that's the most effective. We have to, for parents, because parents care about their kids, they just are not informed about the dangers, about what this is doing to undeveloped lungs and brains of young children and teens alike. And so, there are all kinds of messages that need to go out to all, but in the end, it has to be an individual decision that a kid makes. And we as adults have to have empathy for this industry that is marketing to them, that have put them in these situations that they're in, and work with them to help to get out of this addiction, and work together for them to believe, because they have to believe that this is not for them. And so there have to be messages that we are sending out that will sink into their brains and into their hearts to know that this is not what they want in their lives.
Thank you. So thank you to our first panel. Now I'd like to welcome back Ms. Tanya Edwards to introduce our second panel. Tanya?
Thank you, Sherry. Our second panel today represents the work that is being done at the state and medical levels to combat teen vaping. Our first panelist is Dr. John Zerwas. He is the Executive Vice Chancellor for Health Affairs at the University of Texas System. Dr. Zerwas provides oversight and guidance for UT's 6 health institutions. Prior to joining the UT system, Dr. Zerwas served 14 years in the Texas House of Representatives. In 2019, Dr. Zerwas passed state legislation raising the age to buy tobacco products to 21 years old. Our second panelist is Dr. Monge. She is the Chief of Adolescent Medicine at Dell Children's Medical Center and the Assistant Professor of Pediatrics at UT Dell Medical School. Jennifer Steele is the Associate Director for Tobacco Prevention and Enforcement Division at the Texas School Safety Center, where she oversees the statewide tobacco prevention program, Say What. Jennifer also manages multiple tobacco surveillance and enforcement programs for the state. And our final panelist is Ms. Shelby Massey. She is with the American Heart Association, and she is our Government Relations Director for the state of Texas. She works on policies at the state and local levels aimed at improving the cardiovascular health of all Americans, which focuses on reducing tobacco use, healthy eating, and active living, as well as access to care. Thank you all for joining us today. We will now hear from each one of you to learn more about what measures can be taken to stop teen vaping and prevent future use. Dr. Zerwas, will you kick us off?
Absolutely. Well, thank you, Tanya, and thank you all for the opportunity to be here, and to the panel that just spoke, thank you all for your very compelling testimony. I think what you can see is the success in having passed Tobacco 21 last session really resides with these people over here. And the courage that they had to come forward, sometimes against some of their peers' wishes and demands, but to come forward and to really convince legislators other than myself. Obviously, I had bought into this, but there were many in my camp that had not. And the kind of testimony you heard from these individuals, both from the parent and the teaching, and as well as from the individual student's perspective, is very, very motivating, very compelling when it comes to not only this legislation, but any legislation where we're looking at the future generation, which is really what I certainly had myself involved in the legislature for, was how could we do things to make Texas a better place than it even has been for me or for others for that generation that's coming around. And so Tobacco 21, as you may know, this was not the first time we took a run at this. We did it in 2017. Didn't get the momentum that we needed to get it across the finish line. Not unusual for legislation. Sometimes you have to test the water first before you can finally jump into it and make it happen. But in 2019, I was approached by a number of the advocates, a whole coalition of them, as a matter of fact, and said, hey, Zerwas, would you take another run at it? And at that time, I was chairing Appropriations Committee, as I was in 2017, and so I had my hands full with a lot of stuff already. And I was very honest with it. I said, look, you probably want somebody that can give you a little bit more effort on this and time and so forth, not to mention my staff was pretty overwhelmed with a variety of things. And they convinced me to take it on. They're a very convincing group of people. And so I said, okay, I said, as long as we all understand that a lot of this work is going to happen outside my office. And that's really what you've already heard, is the amount of work that was done outside our office, and really deserves the credit for getting this thing across the finish line. We tied the legislation up and put it in a package and tied a bow on it, and fortunately got the votes that we needed to get it across the finish line. Senator Huffman was the author of the bill in the Senate, and she was very, very effective. And frankly, she had a little bit steeper hill to climb in the Senate than I had in the House, as it turned out. But what was really very compelling about this was not, interestingly, not the tobacco part of it. We have been down the road many times around trying to do things to limit the amount of tobacco use in youth. And in fact, as was already noted, we were making real progress and continue to make progress in the tobacco products. We're seeing smoking on the downfall in that regard. But we saw a bigger thing replacing it, and that was the vaping devices. And so when we took up Tobacco 21, we said we've got to have the vaping devices in here also, both the closed and the open systems. And so that was probably the one thing that really compelled my colleagues, who were perhaps a little bit hesitant about pushing the tobacco part of this again, because they all came into the whole rebuttal that, well, if you can send somebody at 18 to fight for your country and handle a weapon, why can't they choose to have tobacco? I think that's a very dishonorable comparison to make personally, and I made that point to a lot of people when we had this conversation. But when you started talking to especially some of the younger members, or my age, where you've got kids, grandchildren in elementary school, you started to say, whoa, wait a minute, now this is really touching me this time. And they weren't seeing a real, way to deal with it. Epidemic is an exact right way to describe it. And now that we're sort of in the midst of watching the coronavirus, a true epidemic, we understand what the magnitude of something like that is. But that was the thing that said a lot of my colleagues who were hesitant about pushing the tobacco side of it said, whoa, this is really touching a lot of children and perhaps even their children. And it got them on board. There were those who did try to sabotage the legislation. There always is with any legislation, doesn't matter what. But we were fortunate that because of the compelling testimony that was given by the folks that are represented up here, really kind of pushed this thing over the edge, not only in the Senate but also in the House. We were very proud to get to carry that bill. The advocates did a terrific job of really rallying the vote that we needed to get it across the finish line. But as noted among everybody up here, this isn't the answer in and of itself. It's a huge statement to say that we're going to create significant penalties in the law for doing this kind of thing. And the hope is that will have some impact on there. But as we've seen with any number of other things, such as alcohols and such as with cigarettes, there's going to be ways to get around it for sure. And some of the parental behaviors that are exhibited, as was already noted, are things that can perhaps lead to some of these things and stuff. So ultimately, this is going to be attacked, and it's going to be a success in limiting by virtue of the kind of groups that are represented up here, right at the front line, right at student and parent, right at the teacher, right at the school superintendents, and very importantly, peer-to-peer, because it's peer-to-peer that's causing this thing to develop, and it spreads like a coronavirus once you start getting to use it and the effect that it has on you. But peer-to-peer can also be the solution. And so these folks down here who have taken the courage to stand up among their peers and say, this is not good for what you're doing. You can talk all you want to talk about the developing brain and its susceptibility to addiction up through the mid-20s and so forth. But there's nothing like peer-to-peer to say this is not a good thing for you. And as I always like to point out in this bill, when I had people questioning why we're pushing it, I would tell people, this is not about the 18-year-old. This is not about the 18, 19, and 20-year-old. This is about the 14, 15, 16, 17-year-old, and as the superintendent has pointed out, even younger than that. I said, that's what this bill was about. This bill was about trying to move these products further away from the schools so that they would have less opportunity to get their hands on it. Again, not the total solution, a very strong statement. There's more we can do. We can do more to limit, if not outlaw, these flavors that are highly desired by the youth, and then they come with a plug of nicotine, as noted, and boom, like that, you're going to be addicted to nicotine and all the problems that come along with it. And nicotine addiction in your teenage years, 14, 15, 16, I'm maybe talking about stuff you're going to talk about, the likelihood of kicking that addiction is really quite low. Talk to anybody who started smoking in their teenage years and their ability to really ultimately kick that habit. The numbers are not encouraging at all. So thank you all for being here, taking the time to be part of this. I want to thank these individuals over here who have come and really laid out what I think is, where the answer is, and it's at that level, at the front line. The organizations like the PTA really rallying behind something like this, highly, highly effective. So I compliment all y'all on that. Thank you very much.
On behalf of more than 53,000 physicians and medical student members of the Texas Medical Association, we want to thank the PTA for your partnership on past public health issues and through your collaboration with more than 30 organizations of the Texas Public Health Coalition, we have together passed significant reforms such as Tobacco 21. So we really appreciate the opportunity to be here and speak about the medical side of this issue. Vaping and electronic cigarette use has become a widespread issue impacting my adolescent patients and their families. I estimate when I ask, at least 1 in 3 patients that I see in clinic has either tried an e-cigarette or is using them regularly. That's of the ones I ask. This coming on the heels of many years when we had significantly lower rates of cigarette use, so much so that when I asked a teenager if they smoked cigarettes, they looked at me like I was from another planet. Like, who would smoke a cigarette? So this is concerning for a lot of reasons. First, from a developmental perspective, like Dr. Zerwas was alluding to, the human brain continues to develop well into the 20s. I often tell my medical residents that though they are almost 30 years old, their brain is still developing. They don't necessarily love that. But I do feel that it cannot be overstated the importance of the pathways that were lying down for those brains in the 14, 15, 16-year-olds. The other thing that comes at 14, 15, and 16 is this feeling of invincibility. And so that's a problem if you're trying to use scare tactics, if you're trying to use punishment as a deterrent to starting vaping. It's not going to happen to me until it does, right? And so that's what I hear all the time. Oh, don't worry about me, Dr. Monge. I'll be fine. Okay, 2 months later, maybe not so much. But we have to consider where our patients are developmentally before we start targeting our messages toward them. And for many of these patients, we really have to take a different approach than we do to adults with fully developed brains. No offense to the teenagers in the room. The other thing that I see is the immediate health impacts. And so that's going to be of nicotine use, but also withdrawal from nicotine. And so those things can't, I've never seen it like I do now. With tobacco, I could almost always tell because, number one, kids smelled like tobacco, and I would always ask, how much are you smoking? And they looked at me like, how did you know I'm smoking? Because you smell like a cigarette. But I don't have that anymore. I don't have that tool up front to say, oh, wow, this kid's really using a vape. Instead, I'm looking for things like anxiety, irritability, not able to sleep at night. I have kids telling me that they wake up in the middle of the night to take a hit on their vape. That didn't usually happen with cigarettes, or at least not that I was aware of. So this is happening more and more where kids are physically addicted to the nicotine, much more so than before. I'm seeing high heart rates, hospitalizations like we heard Anna talking about. In Texas, 244 people have been diagnosed with EVALI, which is e-cigarette and vaping product related lung injury, which got a lot of press, right? Like, so in the fall, lots of press about a really significant problem with lung injury. I'm going to go back to what I said earlier. That alone, though, is not going to be a deterrent for patients. What they're going to say is, I don't vape THC. Okay, good. I'm glad you don't vape THC. Please don't start. However, the other chemicals that are going into the lungs are directly toxic to lungs. So we've heard it said, water vapor. It's not water vapor. That puff of smoke that you see, that's chemicals. Those are going into the lungs, and they are causing direct inflammatory responses to the tissue. Kids are suffering. We're having significant problems that oftentimes may even be misdiagnosed. If you have the flu and you vape, that's bad. Anytime that you take a hit to the lungs and then you're also vaping, very bad. So we've got a lot of things that are setting up for really poor health outcomes for our adolescents, but then as they go on into their adult years. So in clinic, we've started to ask more specifically about vaping and electronic cigarettes. So no longer can we say, do you smoke? Because they're gonna be like, no, I don't use weed. Okay, no. So do you use electronic cigarettes, Juul, insert other product name? And all of a sudden they're like, oh yeah. And you just think, didn't I just ask you that? But you didn't, because this is considered by many of these teenagers very different and a very different product. So you have to be, in the physician's office, you have to be very specific about the questions that you're asking, or you're not going to get the answers that you're looking for. And I will just add one little point in a study that just came out. It was out of New Jersey. But if you don't include the brand name Juul, a lot of teenagers don't say that they're using. So you actually have to use brand names for them to say that they're actually using the products. So in terms of quitting, I'm going to be honest, the science is not there yet. We're trying, but this is higher nicotine rates in a younger population than what we've ever seen. So we have patients coming in when we try traditional quit methods, and some of them work and a lot of them don't. But really, I think that where our research is headed is a strengths-based approach, an approach that comes from a place of empathy, from a place of what are we missing here? What has happened to you? Now let's work together and figure out how we can make this better. So I think that prevention is really a key. Knowing what to ask, trying to get at people before they start. That's where then we can prevent the outcomes, because what we know now is if you start, it's really, really hard to stop. So the physicians, I think, were very much united in the fight with you all to try to get at this from the very public health roots where it needs to come from. So again, thank you for the opportunity to speak on behalf of the physicians.
Good afternoon, everyone. I'm Jennifer Steele, and I am with the Texas School Safety Center at Texas State University, and have the pleasure of overseeing our state's tobacco prevention initiative. As we all know, or several of us in this room know, the tobacco industry has had a long, long history of manipulating our youth and to create death and disease among society. You know, if we don't know history, we're doomed to repeat it. And that's exactly what's happening, I think, with the vaping coming back on the scene. And we had made progress. And like others have mentioned, people would look at you like you had 6 heads if you said, do you want to try a cigarette? Are you smoking? And everyone would think, no, that's terrible. I've known my whole life that cigarettes are harmful. Everyone that was a smoker would tell you, oh, please never start. We want you to quit. But now when vaping came on, it was something that the non-risk takers, regular students who would never have thought about taking up smoking, all of a sudden found themselves extremely addicted to this device. And we know the vaping industry is similar to the tobacco industry, and oftentimes they are big tobacco and they are the tobacco industry. And what they're really good at is manipulating us, and they're really good at manipulating youth. And one thing that nobody, adults or youth alike, especially young people, that really fires them up is to realize they are being manipulated, and they're being sold a pack of lies, a pot of lies, a stick of lies, whatever you want. And so when, fortunately also in the state of Texas, we've had a long history of trying to combat the tobacco industry. And I've been involved in over 20 years with a funded program from the Department of State Health Services when the state first sued the tobacco industry to create a prevention program that would live on in perpetuity in the state of Texas, that youth could have this peer-to-peer approach and teach one another and partner together with adults and parents in the school and community setting. And that program is Say What, which Kellen had said he's a part of, but it stands for Students, Adults, and Youth Working Hard Against Tobacco. Say What. We need everyone. We need everyone that has an equal part, and that youth can have a part in ownership, and we are in creating their voice in the school setting. Another thing is they don't want to be manipulated, but they also don't want to think that they're doing anything that's unpopular. And if everyone has the idea that, oh, everybody's vaping, that's what I should do, then we empower youth at the school level to really change that social norm and the culture in their school by giving them tools to educate their peers and have the courage to step up and say, not everybody's doing this, and this is why we shouldn't. And then it kind of turns the tide to where it's popular all of a sudden to be healthy, and that we talk about positive things and reasons not to use tobacco and vaping products and the health effects that it causes, and what youth stand to lose if they use these products. So really what I wanted to share with you guys today and Texas PTA across the state is there is a valuable resource, and it's all free, and it's funded by the state of Texas. And it's because of wonderful legislators like yourself, Dr. Zerwas, that have put things in place like this. But sometimes we have a hard time selling it to the rest of the world. And I hate to say that, oh, wait for some tragedy or an epidemic to happen before people listen to you. But we've had this resource available. So I want everyone to go on our website. It's txsaywhat.com, and you can click join our email list and find out all about our resources, which include resources for parents, school administrators, students themselves, downloadable PowerPoint presentations on vaping and other tobacco issues, videos, PSAs. We have a youth advisory council known as the Teen Ambassadors, which Kellen is a part of. Now he's a consultant that he's at the college level. And they actually have video, they have vlogs. We have information that can be played at your school, in your classrooms, or presentations that are downloadable for youth to present to their peers, handouts. We also offer in-person trainings and events that you can find out on our website, from places that we go regionally to annual conference that we hold. There's just a variety of information that's all free to the public to use, and we want you to use it. Also, there's another added feature that if you want to become, or you have groups at your school that want to partner up, we have, you can join to become a Say What member, and then you can receive extra resources where we put, we call them mini grant kits, but they're basically projects in a box where you can say, I'm hosting an event, or I want to have an awareness event at my school or in my classroom. I want to do a presentation or do something in the lunch room at school, all the way to, hey, let's have a 5K awareness event and have something. So you can go online and order these mini grant kits. They come to you free of charge with tips and tools to use, and then you report back to us and how many people you reached. And so far in the 10 years that we've been Say What has been created, then our members have reached over 1 million teens. And so we would like the help of Texas PTA and all the schools around the state to help us reach 1 million more. And I'm sure it won't take another 10 years because that's what we need right now to get the information out. So appreciate y'all being here. Thank you.
Hi, good afternoon. I'm going to close this out today just spending a couple of minutes talking about where we may be going when it comes to tobacco policy from the advocacy perspective at the state level here in Texas. We've mentioned the Tobacco 21 legislation a number of times, and we very much appreciate Dr. Zerwas for his leadership on that issue. The American Heart Association is part of the coalition that did support that legislation, and again is looking at what next steps we may be able to take in the upcoming legislation to continue to impact tobacco use among youth here in Texas. So there's a number of issues that we support at the national level, and we're trying to figure out where the gaps are here in Texas, and again, what makes sense at the state level. One example of something we're looking at is increasing the regulatory framework around e-cigarettes. So for example, retailer licensure. Right now, if you're a tobacco retailer, you have to have a tobacco permit and you have to pay a fee. And you're under the regulatory infrastructure at the comptroller's office that goes and makes sure that you're in compliance with existing laws. So for e-cigarette retailers, standalone e-cigarette retailers, there is no such permit required, and so it's more challenging for the state to know where those retailers are located and ensure compliance with existing laws. So that's an area that we think there may be potential to take some steps to increase and enhance. Another part of that is funding for enforcement and prevention. Funding for compliance checks to retailers for sting operations that local law enforcement is able to do, similar to alcohol, what TABC does to make sure that retailers aren't selling to youth. And then funding for prevention and cessation programs, a lot of what Jennifer has just talked about. That state funding was cut a couple of legislative sessions ago pretty significantly, and so we're working to see is there an opportunity to restore some of those funds. It takes resources to do all these great programs, and so that's an area that we are honing in on as well. Another big piece of this is taxation. So we know from decades of research on traditional tobacco products that taxation is a really effective tool to limit utilization, particularly among youth. And so currently in the state of Texas, we impose an excise tax on cigarettes of $1.41 of every pack of cigarettes. And so there's no such tax on e-cigarettes at all. The only tax that you're paying when you purchase a pod of e-cigarettes is the regular sales tax. So we're looking to see is there an opportunity to do something there, and then that generates revenue to go back into those cessation and prevention programs. And then finally, this has been mentioned several times today, but restricting flavors. There's been a lot of activity in this area at the federal level and across the country as other states are in their legislative sessions. So you may be aware that the Trump administration did put forth a partial ban on flavors. Menthol was not included, so menthol can continue to be sold in any product. And the restrictions that the Trump administration put into place were only impacted the closed system devices, so like the Juuls. The open system devices, like you would purchase at a vape shop, as well as the disposable ones that we're seeing youth more and more. We're hearing more and more turning to those disposable puff bars and those other brands. Those were completely carved out from the federal restrictions. So there are still thousands of flavors that are being sold in those products. We know that flavors appeal to youth. When you're selling things like cotton candy, Captain Crunch, you are appealing to a certain demographic. And until we do something to address the availability of those products, I think we're going to continue to see there be appeal to kids. As we get closer to the 2021 legislative session, hearing from parents and constituents is really critical to accomplishing any legislative work, and so I hope folks will stay in contact with your PTA association, and we will get the word out as we get closer along of what that legislative agenda is going to look like, and we appreciate you guys' support and everything that you all do hearing from constituents on your end.
Thank you all so very much. We've received a couple of questions, and most of those are around the regulation on not only the e-cigarettes but also flavoring. So the first question, Dr. Zerwas, do you believe that the state needs to be doing more to reduce the use of vaping devices, and if so, what should we be doing?
Yes, I think there is more to be done, and as Shelby has already shared with you, some of those things we have taken a run at during the last legislative session, such as taxation. We did take a run at taxation. There was not an appetite for that particular bill, but as I noted, Tobacco 21 in 2017, there was no appetite for either. And so I do think that that's, especially with the highlighted efforts at the federal level, is something that could probably be, considered during the next session. And it could probably be successful, in fact, but any taxation bill is going to have a little bit of an uphill climb. But I think in this case, where you're looking at, absolutely trying to diminish the uptake by virtue of pricing and then taking those monies and putting them into prevention programs is a worthy thing worth doing. The other one is flavors, and that was brought up to me during the last session by one of my colleagues, Dr. Greg Bonin. And unfortunately, because there was such an uphill climb to get that bill through the Senate, if I had sent it back to the Senate with a substantial change to it, of which flavors would have been, there might have not been a second chance at getting that across the finish line. And so in conversations with Senator Huffman, we said, look, let's get this across the finish line, and then let's come back and address the flavors issue. And I think because of how much attention has been placed on this, largely because of folks like yourself and many other advocates, that getting a prohibition on flavors within the state is going to be, it's never an easy task, but there might be a little bit more momentum to get it across the finish line.
Thank you. Dr. Monge, our second question is for you. We're reading that many teens now prefer these disposable vapes, like the Puff Bar, which come in many flavors and circumvent the partial flavor bans. How do these flavored vapes impact the health of the children, and what can we do about it?
So to be honest, I don't know that we have research that actually looks at the flavored vapes versus the not flavored vapes. I just don't think our research has been going on and longitudinally enough to figure that out and tease that apart yet. What I worry the most about, though, is that the flavoring, as everyone has mentioned, is masking the tobacco, and you don't even taste it. Tobacco probably doesn't taste good to most people, and so that wouldn't be something to keep them coming back. But if you get the high from tobacco plus a taste like cotton candy, that on the other hand may keep you coming back. And so I think the health effects really are in terms of the addictive potential, as opposed to it having even more direct lung injury impacts. I think it has to do with just the more kids with more exposure.
Thank you. Thank you all of our panelists. It's been fantastic, and we appreciate what each of you have brought to the conversation. We now want to open it up and take 3 questions from our audience. If you will, Sherry, you want to come up and facilitate this portion?
Yes, thank you. Actually, we're going to start with questions from our online audience. The first question is from San Antonio, and this question is for Kellen. Kellen, you said that some students' approach to vaping is why not? What is the best way to combat that answer?
Just by telling them the health effects. I mean, I know we don't have a lot of health effects out there right now. We don't know much about it. We just know that it's disabilitating to some youth that just use it and then just out of nowhere collapse. Just telling them you might be healthy now, but later it's not healthy. Also, it means that safer is not safe. I heard Dr. Victor DeNoble spoke on e-cigarettes, and he said if you jump from a 100-story building and you jump from a 30-story building, 30 stories might be safer, but the result's still the same. So you're just pounding home that safer is not safe, and that the health effects aren't completely there yet, but they're going to be.
Thank you. So our next question is for Anna, and we're sort of combining a question from KDISD Council and one of their local council or local PTA questions. So Anna, as a young person, what do you think is the best way for parents to talk to their kids about this harmful habit?
Definitely try to see their perspective. I know parents aren't perfect, so they definitely did cigarettes when they were younger or drank alcohol or kind of were in the same boat as us. So I think coming together and being like, okay, this is how I'm going to help you. These are the solutions, not, okay, you did something wrong, just stop, because they can't just stop.
Okay, thank you. All right, so for the last question from our online audience, expanding on a question from our Dallas PTA revitalization team, Dr. Stone, we've heard that some schools are installing vape detectors. What are some measures schools can take to identify these vaping devices, and are they confiscated?
Yes, certainly they are confiscated. You know, again, the trouble that is in our midst is how easily it is to hide them, right? And so, you know, we work with each individual student, we work with our law enforcement. But again, our message that we're really sending out is that we need to be proactive because, as Anna and Kellen have said, consequences are not going to save their lives. Information and this advocacy and the work that we can do definitely at the state level to make it to where the industry knows that we're not going to allow them as a state to market to our young people. And in education, we always say that we are educating our students to prepare them for jobs that have not even been created. And I think that this is a case where students are engaging in something, smoking e-cigarettes, for diseases that have not yet to be created. And I think that that is something that we have to take seriously, and it's going to take everyone to get fired up and come together to make this to where this is not something that we're just letting go by as just a phase.
Right. Thank you. So now we will take up a few questions from our audience here with us today. Please raise your hand if you have a question for any one of our panelists. You will be invited to the podium to ask your question. But before asking your question, please state your name and what PTA and school district you are from. So who is our first person to ask a question?
Hello, good afternoon, everybody. My name is Patricia Stepanek, and I am actually not with the PTA. I'm with a nonprofit organization called Catch Global Foundation. Some of you might know who we are and have heard of us, and some of you might not. I see our Ambassador Samboy up there. So we have a vaping prevention curriculum, and what I've heard outcry from most of you is that there is a need for something in your school, something that isn't quite there yet. So I'm wondering what, if you haven't heard of Catch My Breath or haven't implemented some type of curriculum, what other prevention measures have been taken on your campuses or from the students? I'll open this up to anybody.
I'd like to start. Catch is free and it has curriculums for all school. And I just found out it's the first evidence-based vaping prevention program from the official U.S. Surgeon General, If you implement this program, students are half as likely to experiment with e-cigarettes over the next 16 months. We all know once they experiment with the vape, they're hooked. So this is the first evidence-based curriculum, and it's free. I really believe all school districts should have it. I also believe in a peer-to-peer based approach. We've got to get these teens on board. And I have a question, if I'm allowed to ask.
Sure.
I have a question for Shelby and the doctor. I am involved with an organization out of New York, parentsagainst.vaping.org. I've been involved with them for 2 years. I've been to DC. I've been to Juul hearings. In my opinion, Texas is a day late, dollar short. I can't seem to get people fired up. I don't know why we can't pull these flavors in Texas. I don't know why we have to tax, because kids will pay anything to get it. Why can't we pull flavors? New York is pulling them. California's pulling them. We've got attorney generals suing. We've got governors suing in different states. What is Texas doing, and why do we have to wait? What can we do to pull these flavors? We all know these flavors hook these kids. We got to get the flavors off the market.
That's a great question, and I look forward to
I just don't understand what the delay is, why we're behind Texas.
Yeah, and I think it warrants a conversation.
I do too.
In depth.
Like, what can we do?
Later. Right, and what are we going to do about it?
To speed it up. Because the
Absolutely.
longer we wait, I think there's 7 million kids hooked. So are we going to wait till we have 10 and 1 million elementary school kids? Like, what? Why are we waiting?
Right. So today is certainly the beginning of that conversation, and hopefully will not be the last conversation.
Great.
Thank you. Yes?
Another resource that is available is like to the Teen Ambassador Program with Say What. We do one-day summits throughout the state of Texas, and we usually pick 5 locations, all spread out between different counties in Texas. And it's a big state, so granted we don't reach every part of the state, but those one-day summits provide a lot of information for kids to go out and watch. It's completely free. It's lunch and breakfast is provided, and so schools are invited to bring middle schoolers and high schoolers and hopefully even younger, because if a second grader is also getting these products, heck, they might as well come too, because this information is very valuable. So these one-day summits are great, and it leads up to our Say What conference, which is held in the summer, and we give out scholarships for this conference. And it's a 3-day event that talks straight about vaping and e-cigarettes and about the health effects of tobacco products. And so one of the big things that the Teen Ambassadors do is peer-to-peer education, and we do it through summits, and we encourage those people that come to the summits to also use their voice as well.
Thank you for that information, Kellen. Our next question.
Good afternoon. I'm Riakos Adams. I'm the chair for the KSD, Killeen Independent School District School Health Advisory Council. My question is, I know we want to fight the flavors, and I agree with that, but also we talked about the kindergartners, hopefully not kindergartners, the second graders with the little tools. What are we doing, or is there an effort to either outlaw or restrict the sale of those type of devices that make it look fun to do it? So I'm guilty. I smoke cigars. I can't stand cigarettes. Maybe one cigar a year, but still, cigar is the same. It doesn't look good, and after that one, I don't want to have another one. But if I've seen the pictures of the tools that when you add that with the flavor, all I think is about it's fun and it makes me feel good. So are there efforts to curtail or stop or restrict the type of delivery device that there is?
I'll jump into this as a former legislator, and just say that there is, the pace of change that industry can move through in terms of making devices attractive or making flavors attractive to kids that they want to market to are very fast paced. Your legislature, in terms of outlawing anything like that, they only meet on an every other year basis. So we have a very limited time that we're actually together to actually, actually pass laws and so forth. And so if there is a desire for that kind of thing, again, the most effective way to see legislation come to reality is through the grassroots and advocates and people speaking up about it, and stuff. And then when you get some powerful groups like the PTA and like American Heart and like the American Cancer Association and all the coalition of physician groups that have an interest in this, that's a very powerful effort towards saying, hey, this is one other thing that the industry is doing that's impacting our kids. And so what I would say, at least from the Texas perspective, bring that forward as kind of an item that you would love to see taken on, and then all the hard work that goes with convincing the members of the legislature that this needs to be addressed. What I will say, if I could just in a moment to answer your question, because we only meet every other year, we do have a limited time that we can do. We're in and off cycle right now, so we're in the interim. The legislature is not in place. The legislature can't act to do anything unless they are actually together and stuff.
But this is a crisis and an epidemic. That's my question.
No, nobody's arguing with you that it's an epidemic and the perception that it's a crisis. I'm just trying to lay out what some reality is in terms of doing things. And so unless we're in session, and during the interim, the only person that can call us into session is the governor, the only one that has the power to do that. We can't, and then the governor will also tell us what is on the call. So he also is the one that says this is the only stuff that you can take up and things. So the issue with the flavors, though, and Shelby and I talked about this some as well as others out there, today you would be without a Tobacco 21 law if flavors had gotten included in the House, which is where I was carrying it. And so with that, what I would say is there's a compelling call to do something about that at the state level. There are some federal things that have happened, and I applaud those things. But at the state level, the state only meets periodically in order to put laws in place. And I think there's a very compelling call to outlaw flavors, and that will happen before you know it in terms of January of next year. Unless the governor called a special session for some reason and specifically identified this as an issue that he wanted us to take up. So.
Okay. Thank you. Do we have one more? For our final question from our audience.
Hi, my name is LaDorsha Dameron, and I am from Kyle, I guess. That's where I live now. As an oncology nurse, it's always very concerning, especially about talking about this, especially with youth. I don't necessarily work with youth unless they are 18 and older. But one of the things that I am concerned about is that it is very, very prevalent that adults that are using it and their kids that come in different things. And so we are seeing it in the hospital where they're doing it. So my question would be, is there any statistics or anything that has shown that being around it when someone is actually utilizing the jewels or the pods or what have you, the mist and everything and the vapors and all of that, is that affecting those who are actually around that and gathered around that? Personally, for me, as an oncology nurse and taking care of others and seeing that, unfortunately, I'm exposed to that.
I'm no doctor, but I was at Holiday Inn last night. Don't you joking? No, but I do know. Oh, is anybody hear me? What we've learned is that, as Kellen said, it's not just water vapor; it's secondhand aerosol, and so every leading authority on the matter and the research that has been done especially encourages us to use the term aerosol because it's not harmless. It's not just the steam that comes off of your teapot. is what water vapor seems like, right? And so we do know that similar to secondhand smoke, there is a thing that's secondhand aerosol. And so we all have been educated and are aware that the smoke that comes off the tip of a burning cigarette is harmful to the people around, and is left in the air even after the smoker leaves. And we know that to be true about the particulate matter that is also contained in the secondhand aerosol that comes off of the vape. And so yes, it is harmful, but as Kellen said, we don't have, and as I was saying, we are fortunate that we have been tracking the tobacco industry on combustible tobacco cigarettes and those harmful effects for over 60 years. We haven't had the chance to do that for this industry, but why do we think it's any different? And why are we doubting ourselves that smoke is not harmful? I think regarding to the question that you were talking about flavors, what we do know that's in flavors is that a lot of the flavors, apple, cherry, Captain Crunch, these flavors are approved by the FDA, generally recognized as safe, grass, but they're not generally recognized as safe to inhale in your lungs. They're generally recognized as safe for consumption to eat. We do know also that there's a condition, by the way, called popcorn lung. That is one of the health effects of vaping, and that is your lungs start to look like popcorn with all these holes in them from vaping flavors. And this was first found in workers in a popcorn factory who inhaled the butter flavor all day long in their jobs. And that's why they began getting the condition of popcorn lung after years of working in a popcorn factory. But we're seeing that after not even years of people inhaling flavored vape with those same chemicals. So it's harmful to the vapor, but if that is also out in the air and harmful to the secondhand receivers of that.
And as a physician, let me add one more thing. I think it's not only the physical health effects, but it's also the modeling. So if the behavior is being modeled in front of you as you're laying down the neural pathways that really form your behavior for the rest of your life, if you're seeing vaping as a neutral act or not harmful, that is so impactful. So I think it is the physical, but I also think that very much is the mental health part of that as well.
Thank you all. Thank you to the panel for sharing your stories and for answering those questions in depth. You've given us a ton of information, and it's clear that this should definitely not be the last conversation that we have about this epidemic. Our next speaker is a mother, volunteer, and a personal friend. Please welcome Susie Cannon, Texas PTA's President-elect and Advocacy Chair.
Thank you, Sherry. Now that we've heard so many powerful stories from our panelists, it's time to discuss what comes next. What can each of us do to raise awareness of this health crisis hurting our kids? Texas PTA has a few ideas for action, and we need each of you to commit to doing at least one. Together, we must make sure our communities, schools, and elected officials understand the importance and severity of this issue. We must all work together to address it. Our list is by no means comprehensive, but we think that there's something on it for everyone. We are starting with a PTA resolution for both our councils and our locals. You can see it here. In it, we ask PTAs to resolve to educate, to reaffirm healthy living, and to support pertinent legislative action and school district policies to end this health crisis. After you adopt the resolution as a PTA, we encourage you to notify your school district and perhaps even present it at a trustees meeting. We also recommend that you share it with your legislators. An off-session year is the ideal time to schedule a meeting and get to know your elected officials in your own communities. A few other ideas for you to consider: local PTA briefings on vaping, perhaps a newsletter story written by a student who's been affected by vaping, a student event or program on vaping, and most important, adding your voice to our voice to help stop vaping by joining PTA today. All of these resources will be emailed to our council and local leaders tomorrow. They will also be added to our Straight Talk toolkits online, so please watch for these additions and updates. In order to realize change, we must keep this issue at the forefront of our conversations with our school districts and our elected officials. It is a crisis that must be addressed by everyone that is involved in a child's life.
Thank you, Susie. This afternoon has been invaluable time spent together. I hope everyone that's watching now has a greater insight into this critical issue. And in order to combat something as big as teen vaping, we must learn from one another and rely on the personal perspectives that we bring. So thank you once again to all of our guest panelists, to the American Heart Association for collaborating with us today, and to our viewers here and at home. Remember, together, we can extinguish teen vaping.
Thank you to our PTA. We want to say thank you to our PTA. Thank you for your leadership in this advocacy.
Thank you.